Hi everyone, welcome back to my channel. So today's video is going to be why does saline infusions help POTS patients? So if you do not follow me over on Instagram, then my Instagram account is underneath the same exact name that this YouTube channel is under. So if you want more frequent updates, you can go follow me over there. And if you have been following me on Instagram, then you know that I've been getting twice a week IV fluids for my POTS. In this video, I'm going to cover why saline infusions help POTS patients. So in many POTS patients, they do not absorb fluids through their GI tract. So basically what that means is whenever you drink a lot of water, the majority of that will not be absorbed in a POTS patient. Then in a lot of POTS patients, they do not retain the water, which means their body does not hold on to it. So that's why we're told to increase our fluids and take a lot of salt, along with a bunch of other things to help treat POTS. They also tell us to go caffeine free because caffeine dehydrates you. There's a lot of other methods of treating POTS. I'm just covering why saline infusions help in this video. For those of you who do not know, saline infusions and IV fluids are the same exact thing. Saline infusions is just salt water. That is literally all it is. Now, for most people, they can absorb the amount of water that their body needs and retain it in order to keep their body hydrated and to allow their body to make the blood it needs. However, in many POTS patients, and in my case, that does not happen. So I am basically in a constant state of dehydration, which can obviously be problematic in a lot of ways. So that means that my body does not make the blood that it should be at the rate it should be. Therefore, my blood volume is also quite low. So when I go and get IV fluids, you go in, you get the IV fluids, but what that does is it gives your body the sensation that it has more blood, along with the fluids are going directly into your veins, instead of having to rely on your GI tract to absorb it properly. However, even though the IV fluids are going directly into your veins, you do not retain it the same. So for me, 1 liter of IV fluids are ran over 2 hours. However, some POTS patients do have to get IV fluids slower. But for me, like I said, 1 liter takes 2 hours. However, that time may vary depending on your body. So running the IV fluids slower means that your body will retain it better rather than you peeing it out immediately. So for me, saline infusions only last around the effects of the saline infusions, which basically means the time period that my body feels the benefits from getting the IV fluids is only around 48 hours before all the effects of the saline infusion have worn off. So then you can get another infusion. However, some POTS patients need more frequent infusions. I know I've seen some people get saline infusions every single day, multiple times a day, once a week. Some people do. I do twice a week infusions right now, and I have been for the past month. Some POTS patients only get IV fluids when they're in a flare. Other POTS patients only get infusions when they have a big trip planned or a big event or a test if you are in school, just so that they feel their best, or if you're taking a test, that way your brain fog is not as severe. So the amount of IV fluids that people receive can be different. Some POTS patients don't ever have to get IV fluids. Some POTS patients don't need that. So it's really up to your body, because everybody's body is different. Where I need IV fluids, like my sister does not. My sister does not need IV fluids, and she has POTS as well. My sister is also not on any meds for POTS, and she manages her symptoms with diet and compression socks. So there are many different ways of managing your POTS. However, saline infusions is one of those methods. For me, I do saline infusions, I do the diet, and I do medications and the exercises. For me, that is the best combination for my POTS. However, like I said, your case could be different, and everybody's body is completely different. So what works for me may not work for you. This is completely just my experience and what I have been told. I'm not a medical professional. I'm just sharing my experience. However, the reason why many people do not like to do IV fluids, or I should say many medical professionals don't like to do IV fluids that often, is because of the risk factor. So if you were to do IV fluids every week, or however, it would have to be pretty frequent. So every week or more for a long period of time, at some point your veins would get to the point where they could not handle getting stuck that frequently. And then you would have to get something called a central line. Now, there are many different forms of central line. I believe the two most common central lines is a PICC line and a port. A PICC line is a line that's inserted in your arm, and then it's a tube that travels up and goes into a large artery near your heart. Now, with that comes the risk factor of infection, and since that line goes directly to your heart, you do have an increased risk of sepsis, which is an infection that can kill you. And with a PICC line, it is always there. You cannot get it wet, and there's a lot of rules on how to take care of it, how to make sure and help prevent infection. However, even taking all the precautions, you can still get an infection doing everything right. A port, on the other hand, is inserted under your skin in your chest, and it's like a plastic or silicone type disc that is inserted underneath the skin, that has a tube that runs into the same artery near your heart. But with a port, you can take out the needle, and that's called deaccessing, and then you don't have to worry about it getting wet, where you have to worry about that with a PICC. So there's a lot of different pros and cons to them both. A port is typically seen as the more long-term option. A PICC does have to be changed every so often. A port can last up to a few years, where a PICC only lasts a few months. So the reason why many people don't end up going down that route is because when the pros don't outweigh the cons, which the cons is a central line and the risk factor, then they don't go down that route because it can lead to sepsis. However, in some POTS patients, the pros do outweigh the cons and their bodies do need those fluids. And then that's where sometimes they'll end up with a central line. Some people can get IV fluids frequently and don't need a line, and can just use peripheral IVs. A peripheral IV is what you typically hear about. It's just a normal IV. And some people do perfectly fine with that. Other people have to get a central line sooner than others. So it's all up to how your veins are, and how frequent you are needing the infusions. I hope this video is helpful. Just keep in mind this is just my experience and what I've kind of picked up out through my experience with IV fluids. If you are interested in getting IV fluids, I would talk to your doctors and your team and see if that's an option that could be beneficial for you. And what we did was we did what we call like a trial run. So that's basically where I went and got one infusion a long time ago just to see if it would benefit me. However, I never did end up going and getting more because I knew I didn't have good veins. So I pushed it off as long as I could. Now, multiple months later, my body does need the infusions and I'm getting twice a week infusions. However, I do hope to be able to give my veins a break for a moment, because I do have bad veins. They blow extremely easily. And a lot of times they cannot get a vein, so I have to get IVs done by the ultrasound, which is basically an ultrasound that they look at your veins with, and then when they find a vein that they think they can potentially get a IV in, then they'll look at through the ultrasound and guide the IV in, which does mean they do have to dig for the vein some because they can't see it. They can only see it up on the screen on the ultrasound. And that's how my IVs are done right now. So yeah, although at the 2-hour mark at the end of my infusions, my veins do blow. So my veins don't hold out very long, but they do hold out long enough for me to get my liter of fluids. So that's kind of where we're at right now. That's kind of how and why infusions do help many POTS patients. So yeah, I hope you enjoyed and thank you for watching. Bye.